This is Dr. Bright. I am a Director of Diversity and Inclusion and Assistant Professor of Psychiatry and Behavioral Sciences who has been dedicated to the empirical study and implementation of health equity for 8 years. I am also the Vice President of the Vanbert Health Equity Project. And today, I want to talk to you about mental health in the African American community. Mental health is defined as a person's condition with regard to their psychological and emotional well-being. According to the National Alliance of Mental Illness, while the experience of being Black in America varies tremendously, there are shared cultural factors that play a role in helping define mental health and support well-being, resiliency, and healing. The experience of slavery in the United States and the continued discrimination and oppression endured by African Americans creates intergenerational psychological trauma, leading to a psychological and behavioral syndrome common among present-day African Americans. According to Substance Abuse and Mental Health Services Administration's 2018 National Survey, suicidal thoughts, plans, and attempts are rising among Black and African American young adults. Specifically, Black boys are twice as likely to die by suicide than white youth, and only about 25% of African Americans seek mental health treatment compared to 40% of white Americans. The reluctance to seek mental health treatment can be attributed to socioeconomic factors, where we see that in 2018, 11.5% of Black adults in the United States had no form of health insurance. Provider bias and inequality of care, where Black people have historically been negatively affected by prejudice and discrimination in the healthcare system in the U.S., or just negative attitudes and beliefs toward people who live with mental health conditions. One study showed that 63% of Black people believe that a mental health condition is a sign of personal weakness. However, there are some good ways to move forward. The earlier you address your mental health, the more likely your treatment will be successful. If finances are preventing you from finding help, contact a local health or mental health clinic or your local government to see what services you qualify for. If worried about stigma in your community, access Black Emotional and Mental Health Collective, as well as the Black Mental Health Alliance. And when meeting with a provider, it can be helpful to ask questions to get a sense of their level of cultural awareness. Some sample questions are: have you treated other Black people or received training in cultural competence for Black mental health? How do you see our cultural backgrounds influencing our communication and my treatment? At Vanbert Health Equity Project, we believe that God wants you healthy and that health is freedom. 2 Timothy verse 1:7, for God did not give us a spirit of fear, but of power and of love and a sound mind. If you like this video, please hit the like button and subscribe to our channel. For more information about Vanbert Health Equity Project, look us up on the web at www.vhep.org. And if you're interested in working with Vanbert Health, email us at info@vhep.org. Last but not least, if you want to support the work and mission of Vanbert Health, please give us a tax-free donation via GiveLiffey at Vanbert Health Equity Project or via PayPal at admin@vhp.org. Thank you.